And the heart's job is to pump the blood or transport the blood through the body. So the heart allows exchange between capillary blood, the blood in our capillaries, and our body cells. There are actually three types of blood vessels. Arteries carry blood away from the heart, and most of the arteries carry blood high in oxygen. Veins are blood vessels that carry blood back to the heart, and the blood is low in oxygen, usually. Capillaries are sites of exchange, so the gases, the carbon dioxide and the oxygen, are going to go in and out of the capillaries. So it can either be exchanged between the blood and the air, like in your lungs, or in the body cells between the blood and the body. So this is just showing the heart. It sends out blood. Okay, so this is what's happening in the lungs. Gases are exchanged, and in the tissues, gases are exchanged. The heart can be divided into four chambers, the left side and the right side of the heart. The atria are on top, and they receive blood, and then the ventricles are on the bottom, and they pump blood away from the heart. And remember, or if we talked about it, the right side of the heart has blood low in oxygen, so that's why it's blue, and the left side of the heart has blood high in oxygen, or carries blood. There are great vessels that connect to the heart, to bring blood to the heart and carry blood away from the heart. The pulmonary trunk carries blood from the right ventricle out to the lungs. The aorta transports blood from the left ventricle out to the rest of the body. Superior and inferior vena cava bring blood back to the right atrium. And the pulmonary veins bring blood back to the left atrium. And this has all those major veins labeled, telling the direction that the blood is flowing through them. The AV valves are named so because they are between the atria and the ventricles, so atrioventricular valves. You have a right AV valve that's specifically called a tricuspid, and a left one that's called the mitral valve. Semilunar are between the ventricle and the artery that they're in, and they're specifically named. So they prevent blood from going the wrong direction. That's what valves do. They're like doors that shut to keep blood going in circulation. The pulmonary semilunar valve is in the pulmonary trunk, and the aortic semilunar valve, semilunar, is in the aorta. In green here, we have the AV valves, the right tricuspid and the left mitral, and semilunar. Pulmonary leads to the pulmonary trunk, and the aortic leading to the aorta. Pulmonary circulation. So the heart either pumps blood to the lungs and back, that would be the pulmonary route, or it pumps blood to the rest of the body back to the heart. Pulmonary carries deoxygenated blood from the heart to the lungs, picks up the oxygen, releases carbon dioxide, and the blood vessels will bring it back to the left side of the heart. Systemic is from the aorta, full of oxygen, to the cells in the body. Exchange will happen between gases. The blood will return low in oxygen and come back to the right side of the heart. So this is the basic pattern. We can review that. And these are the two circuits together, pumping blood to and from the lungs, pulmonary circuit right here, and to and from the body cells right there. Notice how both circuits have part of it that's full of deoxygenated blood and part full of oxygenated blood. And there's the pulmonary and systemic separately. Pulmonary, systemic. The heart is in your thoracic cavity. It's in a special sac called a pericardium. It's in the area called your mediastinum. It's more left than right. The superior surface is called the base, and where it comes to a tip, it's called the apex. And there we can see the apex. This is the base of the heart up here. This is where it sits in the thoracic cage. We have the diaphragm, the right and the left lung, sternum. The pericardium itself actually has 3 layers. The outermost one is called the fibrous, and it helps attach it to the diaphragm and prevents it from overfilling. The parietal layer is right underneath that, attaches it to that, and the visceral layer is right up next to the organ itself. In between the parietal and visceral, you have that pericardial cavity that's full of the fluid that helps prevent friction as the heart is getting contracting and relaxing. I really like this image. It shows 3 layers: the visceral, the parietal, and the fibrous. There are other features on the heart that are identifiable when on the outside. You have something called a sulcus that separates the atria from the ventricles when you look at it from the outside. And you have different types. They're called specifically the interventricular sulci, so they're in between the ventricles. Separate the left and the right side. The one on the anterior is called the anterior interventricular sulcus, and the posterior is called the posterior interventricular sulcus. Within those sulci, they're like fat coating almost, you have blood vessels within them, the coronary blood vessels. So here we see a sulci, the anterior interventricular sulcus. And back here we see the posterior interventricular sulcus. We should be able to see these on the sheet part very well. You have 4 normal heart sounds. 2 normal familiar sounds, loved up. Pause, pause. That's the loved up, pause, loved up, pause. Okay, your heart beats, pause. The first sound is called the lub. The second sound is called a dup. The lub is produced from the AV valves, the AV doors shutting. The second sound is from the second set of valves closing, the semilunar valves. They shut in unison. And then there's a rest. The minor sounds you don't need to worry about. They're just clinically useful. So those are the 2 main sounds, the lub dup, produced from the valves closing in pairs of 2. A heart murmur is an abnormal heart sound. It could be caused by different things, valve problems, for instance, and some of them cause problems, some of them don't. Some heart murmurs can be caused by something wrong with the valves, like they're leaky. Maybe the doors don't shut all the way, so the blood kind of regurgitates or goes the wrong direction when it should be going one way. It leaks back into the compartment that it just left. This can cause the heart to get permanently enlarged. The valves can also be scarred or cannot open all the way. Makes it a little harder for the blood to go through the compartments. And again, it could enlarge or dilate, causing higher risk for heart attack and things of that nature. Some people need to have new valves put in, mechanical valves. I've actually put my finger in one in a cadaver. Really kind of cool. So the heart wall is made up of muscle, cardiac muscle. So this is the layers of the heart wall. The innermost layer is called the endocardium. The middle muscle layer is called the myocardium. And the outer layer is called the epicardium. Please note that the epicardium is the same thing as the visceral layer of the serous pericardium, so that outer lining. So you will see a difference in the thickness of the ventricles compared to the atria. And the left ventricle is the thickest because it has to pump. Literally, the muscle is thicker in the left ventricle because it has to pump blood to the rest of the body. And the right side of the heart is thinner, doesn't need as much muscle to generate force because it only has to pump it to the lungs. So this just tells you in words what I just told you, which you can review. So this is the internal anatomy of the heart, which is awesome. There is a septum, as you can see here, that divides the right from the left side, interventricular septum. There's also an interatrial septum. Some people are born with holes in their heart, like my cousin was, in which she had a hole between her atria, so the blood would mix in her left atrium and her right atrium. That doesn't help with adequate circulation of blood. The fossa ovalis is an interesting thing to note in the right atrium. It's a little depression or little divot on that division between the atria, and it's just a remnant of something that used to be there called the foramen ovale. Before you were born, when you were in your mother's stomach, blood bypassed the lungs. It wasn't routed to your lungs in high amounts because you didn't need your lungs to breathe until you were born. So how it bypassed the lungs, meaning the blood wasn't sent to the lungs like it is now, was through the foramen ovale, a hole that shunted blood from the right to the left atrium. And it does shut after you're born when you take your first breath. That's pretty amazing. Also in the right atrium, on the posterior side, is where the coronary sinus enters its deoxygenated blood, and the superior and the inferior vena cava. On the right ventricle, on the inside, you're going to see these muscles called papillary muscles, and they're on the inside wall, and they're attached to chordate tendineae, or heartstrings. And what happens is when the doors open, the heartstrings help keep them taut or tight, so that when they shut, they don't overshut, and they keep a tight grip on the valves. So that you have the valves, and attached to them you have heartstrings, and on the other side is the papillary muscles. The left atrium, we have the pulmonary veins full of oxygenated blood going in there. And in the left ventricle, you also have papillary muscles and heartstrings. So why do we have these doors in the heart? Why do we have these valves? Like I said, it helps keep blood flowing in one direction, from the atria to the ventricles, from the ventricles out of the heart and back into the heart. It helps ensure one-way passage of blood. They help prevent backflow. If you have blood flowing the wrong direction in the heart, it's going to build up in compartments, causing them to become too large. The efficiency of the heart pump, will not be as good as it is when you have tight valves. They are named differently. The AV valve is called a tricuspid because literally it has 3 flaps. The mitral or bicuspid has 2 flaps. Here it's a tricuspid. Open, closed. Semilunar valve, lunar, like a moon. They're like little moon-shaped pieces. Oops, I should say open. So those are the AV valves. They help prevent backflow, the tricuspid and the bicuspid, between the atria and the ventricles. So blood will go from the atria to the ventricles, and these doors will shut to prevent blood from going back into the atria. So now the blood is in the ventricles, and it needs to go out of the pulmonary trunk or out of the aorta. Once blood gets up into those blood vessels, the semilunar valves will shut. So they close when the ventricles have pushed all the blood past them and they start to relax. And each of the semilunar valves has 3 cusps, and you'll be able to feel those in the sheep heart. The pulmonary is named because it's in the pulmonary trunk, and the aortic is named because it's in the aorta. The heart has a big job. It's a muscle, and it has to pump blood to the body. Let's not underestimate